With tonight's NCAA National Men's Basketball Championship game only a few hours away, it's only fitting that we discuss basketball with the Lehigh Valley Health Network. Dr. Richard Camlis recently sat down with our John Eric Poli to discuss common injuries in basketball.
Most of the injuries are going to occur one of two ways, either what we call macro trauma, where there's one specific injury or insult that you recall, or it can be what we call micro trauma, where it's more of an overuse injury, kind of like a tendonitis or tendinosis.
And injuries occur all throughout the body in basketball players too. You said that it could go through the head, it could be in the wrist, knees, ankles, everything. So why don't we start with the head? What are some injuries that might occur, trauma to the head with basketball players?
Sure, most common injuries to the head region are going to be concussion. With the eyes, it'll be corneal abrasions where finger poke to the eye might cause a scratch to the cornea. And in the nasal area, typically elbow, blunt force, you're going to get the nasal fractures.
And how about with your knees and your ankles?
Knees and ankles, typically for the knee, it's either going to be a sprain, and we typically grade the sprain a grade 1, 2, or 3. A grade 1 is you stretch the ligament but no tear. A grade 2 is a partial tear, and then a grade 3 is a full thickness tear. Same goes to the ankle and foot. The other conditions with the knee are usually overuse syndromes like patellofemoral pain syndrome, goes by the name runner's knee, or patellotendinitis, which goes by jumper's knee. And also with the ankle, overuse injuries, Achilles tendinitis, and the foot plantar fasciitis are common.
And then lastly, what about the wrist injuries that are common?
Yeah, wrist and hand, you're typically going to either see fracture of either the wrist bones or the fingers.
And now with injuries, you need to heal up. So if there's anyone out there that's, plays basketball, whether it's recreational at a local Y or something like that, or whether it's with the sports team at the high school, if they have any of these injuries that you were just talking about, what are ways that they're going to have to go about getting treated?
Typically, I tell parents and the athletes, when in doubt, check it out. Oftentimes the schools do not have athletic trainers, so the question is, how bad am I hurt? Can I play? Can I not play? So having a seasoned or an appropriate provider that knows sports med is the first way to go.
And if there's anyone out there that has an injury that's basketball related, you guys can help them out right there at the Lehigh Valley Health Network, correct?
Absolutely. We have a full spectrum of a musculoskeletal team, everything from orthopedic surgeons, physiatrists, chiropractors, physical therapists, occupational therapists, podiatrists. So we basically got the whole gamut of the musculoskeletal system covered.
Thanks, John. And again, if you would like to see someone in the Lehigh Valley Health Network or would like more information on this topic, call them at 570-5014-LV.